set, Samantha? Yes, I see. Event recording is in progress. Well, I would like to wish all the attendees on the line, firstly, a very good afternoon. I'm assuming you may be on European time, so it is afternoon for you. If it is morning or evening for you, then good morning or good evening. And the topic of our webinar today is one that is very close to my heart. It is the core laser, or the Co2re laser, which, as you see in my title slide, I have said it's one solution with many applications. It's really a very versatile device and one of the most favorite devices in my clinic, and I actually have many different Candela devices. So I want to start by explaining the structure of our webinar. We will have, first of all, my 30-minute presentation. That will take us to about 4:30 European time. And then we will have the time for questions at the end. You will be able to type your questions into the window that you see when you're online for the webinar, and you can actually do that at any point during my presentation. And I will be very happy to spend those last 15 minutes answering as many questions as I can. Samantha, did you have anything you want to say, or shall we get started?
Let's get started, please.
Very good. So, as I mentioned, what we're going to be talking about today is the Co2re laser, commonly known as the core laser. And in order to understand how this laser works, we firstly need to understand about the science of interactions between a laser and its tissue. And in this case, the core laser is a fractional resurfacing laser. And so we're going to be specifically looking at the considerations that relate to fractional resurfacing. So we can see here the two types of laser resurfacing that we have commonly available. We'll be familiar with those, of course, the CO2 or carbon dioxide laser, which has a wavelength at 10.6 microns, and the other is the erbium-YAG resurfacing, which is 2.94 microns. Now, what is important for us to understand is that when we are performing laser resurfacing, such as with the core laser, our target, our chromophore, is water. So we can look here at the wavelength of light, and we can look here at the absorption coefficient and see that the CO2 laser resurfacing has an absorption coefficient which is at a peak for water, just as erbium is as well. So always with lasers, the principle here is selective photothermolysis. So what we are doing is targeting a specific chromophore, and for our core laser, for laser resurfacing, that chromophore is water. Why? Because there is so much water in the tissues we are targeting within the skin. We know that the skin and tissues are largely composed of water. So we have high levels of water in the skin. This means that the laser energy will be preferentially targeted and delivered to the skin. And of course, this is what we want in order to address photoaging within the skin. And this is important, that 90% of the water will be absorbed in the first 20 to 30 microns of the skin surface. So we get a very specific, very precise targeting of that upper level of the skin where we want to address the signs of aging. And another important principle is thermocoagulation, that when we target water within the skin, at every area we are targeting, there will be a zone of thermal necrosis around this of 40 to 120 microns. And this is very useful with the CO2 laser to coagulate small blood vessels. And it also ensures that there is a field of effect for the laser resurfacing so that we get a very even and very homogeneous result across the surface of the tissue. So here we can see that visually depicted. You see here the red of the laser beam. We see the vaporization in the immediate zone that is being targeted with that chromophore of water. And then we see a frosting on the surface of the skin, which tells us where the laser is acting on the surface of the skin, and we'll see that in a photo clinically in a few minutes. But then let's understand that around that there is a zone of coagulation, thermal coagulation, which will also result in clinical effects for the patient on the skin. And then around that, we have what we call a zone of hyperthermia, where the skin is heated, but it's not heated to that critical temperature we have within the coagulation zone. So I hope that makes sense. So how does the core laser work? It removes a layer of photo-damaged skin, and it has some very valuable effects below the surface. We have contracture of the collagen, and we know collagen is a very essential structural component of the skin. And it coagulates the microvasculature. This has beneficial effects for rejuvenation, and it also ensures that we do not get bleeding to any significant degree during this procedure. And those of you who've used an erbium resurfacing laser will know it's different with an erbium laser to a CO2 laser like the core laser, where we really get this nice coagulation and control and hemostasis. And then, of course, we also have the potential for collagenesis, the formation of new collagen. And these days, we understand there's also the potential for elastogenesis, formation of new elastic tissue. And if we can stimulate collagen contracture, tightening up the collagen fibers that are already there, restoring them more to a younger form, and then we can stimulate new collagen and new elastic tissue, this is a very true rejuvenation of the skin, where we are moving the skin from an older, photo-damaged state physiologically to a physiologically younger state. So we can look here at the progression, the evolution of laser resurfacing, and see how the digital technology of core gives it a big advantage in our clinics. We started off, of course, with full laser resurfacing. It's an effective treatment, but we have some limitations. One of the limitations, as we can see here, is a prolonged recovery time. And it's not just the epithelialization of the tissue. Many patients, and I found that it's particularly the skin types 1 and 2, can have prolonged erythema even after epithelialization, even for 6 months or 12 months, and it's not really predictable who will get that. And of course, there's more pain involved. We either need to give nerve blocks or sedation, or frequently both of them together. It's a very intense process for the patient. And because we're breaking the skin, there is more risk of infection, scarring, other complications. So it was a very good technique. But a big evolution was to move to fractional technology, whereas you can see, looking at these areas of frosting on the skin, we are able to treat certain areas of the skin with skip areas in between. But because we know the zone of coagulation will extend beyond the zone of chromophore targeting, we get a smooth, even rejuvenative effect. So the benefit of fractional resurfacing, even in the early generations, was that we could get very good efficacy of our rejuvenation treatment, but reduce the downtime and reduce the risk of adverse effects. So now we move to a third generation of fractional technology such as core, and we have even more versatility. And one of the things I really love about the core is it is so versatile in terms of the extent of treatment. We can go all the way from a full fractional resurfacing with very profound effects on the layers of the tissue we are targeting, a lot of tightening, a lot of improvement of the rhytids, all the way to something very light for a patient if they just want to have a freshening of the surface. So it's a very customizable treatment that can be individualized for patients. And unlike the full laser resurfacing, I find I can use this core laser in all skin types. Yes, even through from skin types 1 to skin type 6. And this is a phenomenal advantage for me because I'm in Washington, D.C., and we have a very diverse patient population then. And in fact, the populations all over the world, in Europe and elsewhere in the world, are diversifying. And even in Europe, indigenously, of course, we have a lot of Latin patients, and we want to be able to treat the full spectrum of patients in order to be as effective as possible in the modalities we offer our patients, and of course also as cost effective as possible. When we buy a laser, the more often we can use it, the more cost effective it will be. So the most notable differentiator when we look at the core laser compared to other types of fractional resurfacing laser of the new generation is this digital superpulse. And here we see the graphics borrowed from another company that uses this type of technology. But this is why we have the initial CO2RE. The RE in core stands for radio frequency excited. And as we can see, looking at these waveforms, it's a very precise way of delivering energy without a subablative tail of energy that is not really going to create significant treatment efficacy, but can cause adverse effects. So let's see how that works. What is superpulse? Well, it limits the amount of epidermal necrosis, and that's why the core is such a powerful laser, because we are able to target below the surface into the dermis where the collagen and the elastic tissue is without getting as much damage to the epidermis, which is going to result in longer recovery time, greater risk of adverse effects such as scarring. And because we're limiting the amount of epidermal necrosis, this is why core is such a suitable laser for diverse skin phototypes, even the more pigmented skin types. So the core system superpulse is different from other types of superpulse because it's radio frequency excited. And that gives us a tremendous precision. We can turn this laser on and off very quickly in comparison to lasers where the pulse is turned on and off by direct current or DC. So this is the power of radio frequency. And those of you who know, or those of us who know the Candela technologies will know that a great many of them use radio frequency in one way or another. A radio frequency is a fantastic light energy. And in this case, the way it's being used is to excite, to switch on and switch off very precisely with the sharp rise in the peak of energy delivery and the sharp fall for this resurfacing laser. In comparison to other types of superpulse where we have this sub-ablative tail of energy, which causes residual heating of the tissues and can result in less efficacious treatment and also a significantly increased risk of adverse events. For instance, if this heat is being delivered after the major pulse, the melanocytes may not have thermal relaxation time in between this pulse and the next pulse. And that is why we can have limitations with this type of device for skin of color, which we don't have with the core. So here we see why pulse type matters. It's also a more comfortable treatment because we don't have that subablative tail, the buildup of heat energy, which can cause pain. So we find the core laser is a very comfortable treatment. Typically, I'm using just topical anesthesia in my office, and sometimes I supplement with nerve blocks. There are a variety of other types of comfort control. One thing that's used here these days is Pronox, which is a low dose of nitrous oxide just to make patients a bit more comfortable. But it's a very, very tolerable treatment. Now here we see why fractional resurfacing gives us a shorter downtime. We can see here the area of ablation histologically. So we see the uppermost dark layer of this histological specimen is the epidermis. And then we can see the dermis below that with the pink collagen fibers. So we see here a sparing of a significant amount of the epidermis. And because that epidermis is undamaged and intact, we get a quicker healing and a shorter downtime, but we get all the efficacy below the surface to stimulate collagen contracture and the formation of new collagen and potentially new elastic tissue. So this is what makes core very versatile, that we have these different modalities that we can choose. Now we can vary the shape of the resurfacing that is being delivered, but here we see just the different modes that we can use. The core light, which I use for what I call to patients a laser micropeel, and we can use it in thin-skinned areas of the face as well. We have then a mid modality, which is mid-level, as that name would suggest, and we have a deep modality. And then we have a modality that I use the most in my clinic, which is the fusion, which is a combination of the mid and the deep. So here we can see if we use these different modes on the skin, we get a different pattern of frosting. We can see here the light, we can see the mid, the deep, and the fusion, which is a combination of mid and deep. And here we can see on the full area resurfacing the perioral region, the fusion, which is what I really like to use in this area. And we can see here the mid mode, like that's forehead. And we can see here the light mode for the nose. And another area I like to use the light mode, where appropriate, is in the periocular region. So laser resurfacing, carbon dioxide laser resurfacing is very versatile. Yes, we can treat rhytids, we can treat scars, and we can also address pore prominence, dyschromia, including melasma, and redness of the skin, and also seborrheic keratosis, sebaceous hyperplasia, other lesions such as angiofibroma, lentigo simplex, and rhinophyma is a fantastic indication. These are patients who have enlargement, distortion of the nasal tissues, and treating them with the core laser, I find, can be transformative. After treatment, we can use a thin layer of petroleum or petrolatum-based ointment, cool compresses as needed. We advise patients to hydrate, and they should try and sleep with their heads a little bit elevated for the first few days to limit any facial swelling. And of course, we advise a broad spectrum sunscreen. Post-treatment vinegar soaks can be used. They're very soothing to the skin and they help with epithelialization. We advise patients to be applying the ointment frequently. Every time they do a soak, they can apply the ointment afterwards. And they may see some sloughing or desquamation or shedding of the treated skin after about 5 days. That's going to depend really on how we customize the treatment for the patient. I'm going to draw your attention here to this herpes simplex breakout. Of course, with laser resurfacing, we would aim to prophylax with antiviral treatment any patients who have a history of cold sores. But if it happens that they develop one unexpectedly after treatment, it's not a problem. We just need to treat it. As far as prolonged edema and erythema go and post-inflammatory hyperpigmentation, this is one thing where I've been very, very pleased with my core laser. Because I really find that I'm not sitting there worrying about these side effects, providing I use the appropriate parameters and the appropriate technique. I've never actually had a problem with this. Now let's look at the parameters which I mentioned. So these are, typical parameters just drawn for the face. Here we're showing the mid mode around the eyes. As I mentioned, sometimes I use light mode, especially for physiologically younger patients. Fusion mode for the area where we really get a lot of photo damage and aging and, the barcode, the vertical lines on the upper lips, which laser resurfacing is so perfectly designed to treat. And then we can see the mid mode in green here for the chin, for the cheeks, and we can use a lighter mode for the forehead. So this is such a wonderful aspect of this device that we can customize as a whole for the patient based on the extent of physiological aging and the skin phototype, and then we can customize even with 4 different modes for any individual patient's face. And so as I said at the beginning, we have many treatment solutions, and here we can see a precision of the estimated ablation depth with each setting we may use, each mode and each energy setting. And the other thing we can vary with the parameters is the percentage of fractional laser coverage. So we have many different ways to customize and individualize this treatment. Here we can see what the handpiece looks like. It's actually a very simple assembly. And here we can look at the energy and pulse duration. So we have a good range of energy that we can deliver. Obviously, the higher the energy, the deeper the treatment. Pulse duration. Obviously, the longer the pulse duration, the more will be the lateral beneficial thermal damage to the tissue in order to achieve that collagen contracture and formation of new collagen and elastic tissue. And then we can vary in the parameters the fractional percentage, how much of the area are we covering, and we have a range here. And please note, we can even go to full ablation with the core laser should we so desire. So how deep? These are general guidelines. Of course, when you get your core laser, you'll get a very good training from the Candela support team on this. But for dyschromia, the brown pigmentation or redness, we can use a mid-mode. For fine lines, we can use a deep or fusion. For even deeper lines, such as the barcode around the mouth, we can use either the deep or fusion mode. And then we have a very nice option to treat acne scars as well, again with deep or fusion. What about other applications? Well, we can do classic resurfacing if we so desire. There's a school of thought now that sometimes it can be beneficial with the lighter skin types to move back to that original classic resurfacing, even though there's a longer recovery time for the patient. And if we so desire to do it, it's available on the core laser, but we should never do it on darker skin types. Really, from skin types 3 onwards, I would advise extreme caution or avoidance with this. We can ablate seborrheic keratoses, skin tags, and other lesions like angiofibromas. And we can also use this device for cutting and for coagulation surgically. So this is one of my patients. You can see she's a skin type 4, and here I've treated her acne scars. And this is just one treatment, actually, with the core laser. And I think you can see with the fusion mode a very nice result. And what's more important as well, she has no adverse effects such as post-inflammatory hyperpigmentation. And she was extremely happy with this treatment. Here's another of my patients just to show you how versatile the light mode is as well. With the so-called core laser micro peel, what I tell my patients is they can do a series of treatments with this, even one every 3 or 4 weeks, and they will have minimal recovery time, maybe a day or a couple of days where they need to be applying a little Vaseline, usually only a day. But you can see even after one treatment for this patient, again with skin type 4, do you see how the pigmentation is improved? Pores are tightened up and we have more skin radiance. So this can be a very nice option for patients who want to freshen the skin surface. Here we can see a patient who has more photo damage. With treatment 4 to 6 weeks afterwards, we see the redness has gone away, a significant improvement in tissue quality and in removal of the rhytids, improvement of those. Here we can see again, even 4 to 7 days after treatment, very little redness compared to the older generation laser resurfacing. And at 4 to 6 weeks, we see a lot of improvement in the pigmentation and the quality of the skin and in the rhytids. And here we can see, again, that multimodal treatment using, customizing different modes, different depths, different fractional resurfacing coverage, different lateral thermal targeting. And again, we see a very nice result 3 months afterwards for this patient. So what about pre-treatment considerations? Well, we can see here the progression we might go through. So patients starting pre-treatment, this is day 1, of course, compresses, soaks, and a petroleum-based ointment. But look, by day 3, we've already got full epithelialization. There's some erythema. That erythema starts to resolve very quickly, and by day 7, we have mild erythema. And here we can see pre-treatment of 5 weeks post. So one of the great benefits of the core laser is it's efficacious, and also it's very predictable for patients and for us. Now, I want to close the last few minutes by mentioning another add-on to the core resurfacing laser, which has really transformed my clinical practice, and that is the Co2re Intima. What is the Co2re Intima? It is for feminine wellness or feminine health, and it is an add-on handpiece which will treat the vagina, the vulva, and the introitus, which is the entrance of the vagina. And with that, we can do a classical fractional resurfacing with all the benefits I mentioned for the face. But in this case, we're treating dyschromia, vulvar dystrophy, improving skin texture, and just as on the face, we can remodel the connective tissue. And it's a disposable, single-use external handpiece. We also have a multi-use surgical handpiece which can be used to excise or incise, ablate or coagulate the external vulvar tissue. So with the Co2re Intima tissue, if you're looking at feminine rejuvenation, the difference is that we can treat every aspect of feminine rejuvenation, both internal and external. And that is the power of a true resurfacing laser as opposed to a light energy. And the other issue with those light energies is they don't really reach the temperature to truly remodel the tissue the way a fractional CO2 resurfacing device can. So here we see that single-use handpiece for the vaginal insertion, and the external, sterile, this is autoclavable, vaginal handpiece for treatment of the external regions, and the multi-use surgical handpiece. So this is a complete portfolio of vaginal rejuvenation or feminine rejuvenation options. So we're all familiar with the genital anatomy. The pathophysiology here is that we can do rejuvenation of the labia, the vaginal canal tightening, stress incontinence. This has been tremendous for my patients. I'll share with you in a moment or two a testimonial from one of my patients about this. This is very common for women after they've had children, and it really significantly affects their confidence, their self-esteem, and their quality of life. And then, of course, we have vaginal atrophy, and up to 50% of postmenopausal women. I would say from my patient population, it's more than that. And this is an issue of discomfort in daily activities, discomfort during sexual activity. And again, it's a big quality of life issue. And then patients who've had radiation treatment, cancer survivors, patients who've had treatment for cancer like chemotherapy for breast cancer and been pushed into menopause as well. We're talking about local effects and also effects from treatment elsewhere. This device, the Co2re Intima, has tremendous potential. So we can treat loose skin, we can treat skin texture, tissue texture, and pigment changes. Patients who are postmenopausal, patients who've had childbirth, and hormonally mediated changes. And vaginal canal laxity after childbirth and sometimes after surgery. Stress incontinence I mentioned, and as the estrogen levels decrease in patients as they approach perimenopause and menopause and postmenopause, this can be quite debilitating. And we now recognize scientifically a genitourinary syndrome of menopause caused by decrease in estrogen production. There are multi-center studies showing objectively that this starts 1 to 6 years after menopause. We get atrophy of the mucosa and vaginal dryness, vaginal discomfort, and the whole pH and the microbiome of the vagina changes as a result. And these are all the symptoms we can get which really impact quality of life. It's something women have not spoken about for a long time, but what I find is once we open that conversation with patients, there are very many of them suffering from this and did not even know there was something that could be done. So these are frames from the video, but I'm going to move on to show you the study here, which was done on the porcine model, performing the internal core laser treatment of the vagina in a swine model. And here we can see the histology showing the ablation and coagulation, just as I showed you for the face, in the target areas. And here we can see how we perform it. So this is method 1. I actually like to use method 2 more often, but the idea here is just to make sure that we are addressing the full depth. So we insert and then apply the pulses in this method in a linear fashion while the handpiece is being pulled back 1 centimeter at a time, moving around the clock. This is what I like to use, which is to deliver the pulses around the clock at the same depth while withdrawing the handpiece. So we deliver around the clock at this depth, number 2, and number 3, number 4, and so on and so forth. So we get a global treatment of the whole vaginal canal at all the depths, and it's quite comfortable for the patient. So the core laser is the gold standard in tissue remodeling, formation of collagen and elastic tissue, and neovascularization. With fractional techniques, we can penetrate deeper. And this is what I was talking about, that the temperature that we get to with a laser such as the core laser for the feminine rejuvenation gives actually a true collagen contracture and collagenesis and elastogenesis. Here's the external Just as in the face, we can fractionally ablate and coagulate and improve skin texture. And this is a testimonial from my patient, which was, she was in tears when she told me this. This treatment has transformed my life. I'm able to lift my grandchildren now without worrying about urinary leakage. And she's actually been my core patient for the face and did not even know something could be done for these postmenopausal symptoms. And there are so many testimonials. If we just go and talk to our female patients, we will find that so many of them are suffering in silence. And more testimonials for this treatment. So I would really recommend to all of us to open this conversation. And I'm going to close now. I mean, this is, pre-procedural, post-procedural prep, which when you do your training for the core laser and the core intima, you'll go through all this with your Candela specialist. But one thing I'll just emphasize is that if we are doing the core intima treatment, I always insist the patients have a GYN, a gynecological evaluation with up-to-date pap smear before they come to me for the treatment. And I think that's the last point that I will make. This is just showing you the treatment which I described to you already and the internal placement. And just, to be pulsing around the clock, and we can customize again. This is a very individualizable treatment. And this is the external treatment of the introitus and treatment of the labia minora. So, if I can give you a take-home message with the core laser, the core intima, it reaches sufficient temperature to truly remodel the tissue in this region. I typically do 3 treatments spaced 4 weeks apart and consider a maintenance session at 1 year. Second take-home message for the core intima is that it's a global solution for feminine rejuvenation, just as the core laser is a global solution for the face. It's very customizable and can be individualized for patients. So I'd like to thank you for your attention and now open up to the attendees if you have any questions. And if there are no questions at the moment, I'm going to share with you a couple of questions that I have received very commonly about this device, which is, first of all, how do I select, between different types of laser resurfacing? There are so many different fractional lasers, and when we go to conferences, it can be quite overwhelming to see all these devices and try and decide which one we should purchase. And I want to first of all say I have bought my core laser, just like all of you have done or will be doing. Okay, it's not that someone is giving me it for free. So I had to go through the same decision process. And for me, this is how it worked. First of all, I want to know that the device itself is going to be safe and efficacious, and that there have been a lot of studies performed by the company. Now, I will say that Candela, one of the things that distinguishes this company to me is that it's a very evidence-based, scientifically focused company. And if we look at any of the devices within the Candela portfolio, and I have many of them in my office and I've purchased them all, there are a large number of peer-reviewed publications and studies that have been done on this device, and it's always increasing. So if we go to our dermatology journals, to our laser medicine and surgery journals, we will see good studies on these devices and good data that we can use as a reassurance to ourselves as to the efficacy and safety of the device, and we can also reassure our patients with that. So that's number one, that we need to look at the background of the device itself in terms of the evidence and the data and the publications. And we need to look at a whole as the company. Is the company focused only on selling, or is the company focused on a scientific, evidence-based approach? The second consideration for me is that I need devices in my office that can treat diverse skin types. Yes, I have plenty of patients with skin types 1 and 2, but I have also a very wide range of skin types going all the way through to skin type 6. And I shared with you some results from my darker skin patients, specifically because with the previous technologies, they would not have been able to receive laser resurfacing. So I think it's really wonderful that we have devices like this that we can customize and individualize to our patients of all skin types. And personally, I consider it my responsibility as a doctor to be able to offer treatments of this type to all my patients, not to have to say to some of my patients, I'm sorry, this would be a good option for your acne scarring or for your pigmentation or for your dyschromia of other types or your photoaging, but unfortunately, I cannot offer you a device that will address these problems in your specific skin type. That's very important for me. And the third thing I think is very important. So I've given you 3 important points, is technical support. We want to be sure that when we purchase a laser, the company from which we're purchasing it is going to be around for the long term. And I'm sure you will all know that Candela is a very well-established company. It's a very highly regarded company. And that company is not going anywhere. It will be there to serve us now and in the future. And I know from experience, if I or my clinic staff have any questions or concerns with the device in the clinic, we can get on the phone right away. We can speak to technical support and we can get our problems or our concerns addressed promptly. And that makes a huge difference in a busy clinic where we don't have time to be waiting 1 week, 2 weeks for a replacement handpiece to be shipped out or for something to be fixed on the device. We get very prompt, very considerate service, taking into account that we are a busy clinic and we cannot afford to let our patients down. So those are the 3 things I think are very important when we are considering what device to buy. Number 1, the evidence, the data, the publications, the science behind the device itself, and the approach to evidence-based medicine and scientific approach of the company itself. Number 2, the ability to customize and individualize this treatment for as many patients as possible within our clinic. Younger patients, older patients, patients with lighter skin types, patients with darker skin types, patients who cannot manage a lot of recovery time. Many of our patients are busy. They don't want downtime. This is the trend in aesthetic medicine as a whole. And we have the ability with this device to customize the recovery time as well. And it's a very predictable efficacy, predictable results, predictable downtime. And I will include in the versatility the fact that with this device, I get not only my facial resurfacing, but I can resurface the body, including the neck, the décolletage, the arms, the legs, because I have those 4 modalities to choose from. And I have also the great variation in coverage with fractional ablation ranging from 1% all the way through to 100% should I so desire. And I can also vary the energy delivery. So my fluences can be very, very precisely customized to each patient's need. And then the other aspect of versatility, of course, is that I have the option to perform the feminine wellness or feminine rejuvenation, which has become a big part now of my practice, even though it was something I had never thought about discussing with my patients before. I find that they are so grateful and so happy to know that there's a solution that exists, because women are reaching menopause from the late 30s or from around 40 onwards, many of them. And these days, with our baby boomer generation, Generation X, they have every expectation that the second half of their life will be as worthwhile and active and good in quality as the first half of their life. And it's really, for me, been a wonderful experience to be able to offer to my patients the Co2re Intima treatment to improve the quality of life of my patients, as well as offering the core facial and body treatments. And then the final thing I mentioned as an important consideration when we are looking at what device to buy is technical support. Make sure that the company from which we are buying is established, that it has a very good reputation in our field for being responsive and providing a high level of technical support, and that it also provides a good training program. When we buy a laser, we should have the expectation that the team will be available for us and for our clinic staff. Now, I have a question here. How does the intravaginal handpiece work? Is it automatic, or do I have to rotate the handpiece by hand? The answer is that we rotate it by hand. So we move around the clock as we use this handpiece. Let me see if I can go back to those images and I can show you for the internal. So this is, a cone-shaped or a linear device, and we're going to insert it into the vaginal canal, and we insert it to the deepest point in the vagina and rotate so we can see the mirror on top is at the 12 o'clock position, and we can see a marking, and that's the starting point of our treatment. And then we pulse once at this 12 o'clock position, and we rotate clockwise. And then we pulse at that position on the clock, and then we rotate again. And we continue pulsing and rotating until we've made a complete 360-degree treatment at that deepest level in the vaginal vault. And then we pull back the handpiece 1 centimeter. There's a marking on the device to show us exactly how to do that, so it's very easy and precise. And then we repeat that pulsing all the way around the clock from 12 o'clock round until we reach the full circumference of the vaginal opening. And then we go all the way back in the vaginal vault, withdrawing at 1 centimeter each time until we reach the introitus. So there we are. In a matter of a few minutes, we can treat the whole of the vaginal canal very precisely and do extra pulses if needed at certain points on the clock for extra tightening. Now, I have another question. What parameters would I use for a female patient aged 45, skin type 3 or 4, thin skin without scars, and only slight pigmentation and wrinkles? And what I will say for this is that I would, first of all, discuss with the patient the balance between efficacy and recovery time. So we have the modalities that I've used on this type of patient. I have used the fusion mode for this type of patient. And I have also gone to the mid mode, and I have used the light mode, as I showed you, when a patient wants a micro laser peel. So if a patient wants more tightening and they have more wrinkling of the skin, then we would go more with the fusion or the mid mode. If what they are concerned about is poor prominence and skin radiance and evening out the superficial skin tone, then we can even go to the light mode and do a series of treatments. Okay, another question. Do we have to treat only the vagina or also the opening, the aperture or the introitus of the vagina and the external parts? Again, that's the power of the Co2re Intima, that we can individualize these treatments. So I generally would recommend that we should treat the introitus, which is the opening of the vagina, when we are treating the vaginal canal, because we are treating that to get remodeling of the whole tissue and improvement of vaginal canal laxity. We want to tighten up there. So when we're performing this whole treatment, yes, we would go to the introitus, and I will just show you again on the slides here. We change to the external handpiece to treat the vulvar region, and this is after we have done the internal vaginal canal treatment. So we're essentially remodeling on the surface as well. So I hope that answers that question. We then can individualize and customize if there are, for instance, we want to improve the labia minora. Here is the introitus being treated. You see that? It's just like, we see the guide beam here, a laser resurfacing of the surface, the introitus and the labia minora, a single pass. We can individualize the pattern size and density and use the light, mid, or fusion modes depending on the treatment goals, which we discuss closely with the patient during the pre-treatment consultation. And here we can see patient, probably postmenopausal with this pale, dry mucosa and petechiae. One thing patients mention very often is that after having this treatment, they see an improved moisture and lubrication of the region. And so much of the symptoms that they suffer due to vaginal atrophy is actually due to dryness of the vagina. It's very uncomfortable sometimes even to walk or to perform normal activities because of the chafing. And after this treatment, there's a big improvement in that. And here we can see treatment of the labia minora, again, a resurfacing. And we can customize and individualize that for the patient. For any of you who are performing fillers to this region, that's another emerging indication for rejuvenation. The way I do this is I use the Co2re Intima first of all for the resurfacing and remodeling of the tissue. And I wait at least 1 month afterwards, and then we can inject fillers to the labia majora or the labia minora. And this is a wonderful combined treatment where we are addressing the different modalities of aging, postmenopausal syndrome, post-childbirth syndrome in this region. And here I just mentioned, I think we're probably about at our wrap-up time, but I will just mention finally the post-treatment, which is that we want to apply a water-based lubricant. I use, the KY jelly or ultrasound-based gel afterwards for the patient's comfort. It's very soothing. They should avoid sexual intercourse for 7 days afterwards, no douching of the vagina or tampons for 7 days after. Of course, they can feel a little experience a little redness, even a little soreness in that region. That tells them the treatment is doing something and it's working. I like to see patients for follow-up routinely 7 days afterwards, particularly after the first 1 or 2 treatments. It's reassuring for them. And I tell them to contact me if they have any pain or fever or unusual discharge. They should tell me straight away. So with that, I'd like to thank you all for your attention, and I hope this webinar was of use to you. Please feel very free to be in touch if you have any further questions, and I'll look forward to seeing you at a conference soon. 2 conferences I'll be at next year are the IMCAS Paris conference and also the Monaco AMWC. And I have my own conference I'm involved in directing in London, Season 2020, which is an academic conference at the Royal College of Physicians with hands-on anatomical training. And yes, we do believe in anatomical training, not just for injectables, but for lasers and light-based devices as well. So thank you very much. You can also follow me on Instagram. It's just my name, at Dr. Hema Sundaram. I'll go to the final slide and you can see my name. If you just put at Dr. Hema Sundaram or you look up my name on Instagram, you can stay up to date with my teaching.